Hi, my name is Denise Freire and I'm going to talk about neuromodulation of urinary tract function. First, definition. The function of the urinary or renal system is to help the body eliminate liquid waste called urea and to keep chemicals such as potassium, sodium, and water in balance, excreted by the kidneys. Urine travels from the kidneys through two thin tubes called ureters and fills the bladder. It seems simple, but neuronal control is complex and not fully understood.
Urinary system consists of the kidney, urinary tract or ureter, urinary bladder,
and urethra. The kidney functions as the body's main excretory organ, eliminating body's metabolic waste products by filtering the blood. Substances that are not needed or are present in excess are filtered out of the blood and form into urine, moving into the urinary bladder before being expelled through urethra. The kidney consists of hilus and 18 lobules. Each lobule consists of nephrons. The nephrons are functional unit of kidney, and each kidney contains more than 1 million nephrons. Each nephron consists of glomerule, which filters the blood. Filtration occurs as blood flows into the glomerulus. Electrolytes and nutrients move back from the filtrate into the bloodstream and finally finds its way to the renal pelvis and finally to ureter, urinary bladder, and then to urethra for elimination.
Applications in medicine. Functional electrical stimulation of the tibial, pudendal, and sacral nerves involves spinal cord reflexes and brain network through peripheral afferent. These targets for both the inhibition and stimulation of lower urinary tract function have been potential therapeutic options in urology since the 1990s. Absinthe can be used to stimulate or inhibit contraction of small vessel cells in the bladder. Despolarization of the cells with the use of one absinthe channel rhodopsin-2 activated vesicle contraction, whereas hyperpolarization with another higher rhodopsin inhibited contraction.
Your doctor has recommended that you receive drug therapy for your overactive bladder. The goal is to reduce the urge to urinate and the number of times you need to go, as well as to prevent accidents. Drug therapy with antimuscarinics or with a beta-3 agonist can help. This animation shows how these drugs work in your body and what side effects you may experience. Overactive bladder, or simply OAB, is characterized by the sudden need to urinate and leads to uncontrolled contractions of the bladder muscle. Drug therapy with antimuscarinics or with a beta-3 agonist reduce these contractions in different ways. Both are taken orally. Antimuscarinics bind to specific sites on the bladder muscle, which then leads to a reduction in signals that tell the muscle to contract. As a result, your bladder capacity increases, and you will feel the need to urinate less often. Antimuscarinics also bind at other sites in the body, potentially causing side effects. The most common are dry mouth, dry eyes, and constipation, which can be managed by adjusting the dosage. Drug therapy with a beta-3 agonist is also effective for treating OAB and causes few side effects. The beta-3 agonist binds to another site on the bladder muscle, which then signals the bladder muscle to relax and stop contracting. As a result, your bladder capacity increases, and you will feel the need to urinate less often. Before starting drug therapy with a beta-3 agonist, your blood pressure should be checked. Drug therapy with antimuscarinics or with a beta-3 agonist can affect medical conditions you may have, like allergies. They also can interact with other medications. Check possible interactions carefully with your doctor. When side effects become too severe, or the treatment does not seem to be working, you might need to switch to a different treatment. OAB affects your quality of life. In addition to drug therapy, bladder training and lifestyle advice can help manage your symptoms. Ask your doctor for advice.
Pros and cons. Pros. Current functional electrical stimulation of the tibial, pudendal, and sacral nerves, optogenetic innervation can target specific neurons in the lower urinary tract and thus can avoid interfering with bowel or sexual function. Cons. Neuromodulation is only provided when the device detects a problem.
Overactive bladder medications can help overactive bladder symptoms of frequency, urgency, and urge incontinence by inhibiting the smooth muscles of the bladder. InterStim works differently to help overactive bladder by affecting the nerves of the bladder. This can be used for patients who do not respond to medications for overactive bladder or for patients who cannot tolerate overactive bladder medications. InterStim therapy, or sacral nerve stimulation, can work by stimulating the sacral nerves, and this can reduce the signals to the nervous system that may be causing overactive bladder symptoms of frequency, urgency, and urge incontinence. The first step with InterStim therapy is a simple test InterStim implant that's performed as a very minor outpatient surgical procedure at the Wills Surgery Center in Wilmington. With this test implant, a soft wire is implanted near the tailbone, and then that's connected to an external stimulator, and the patient then experiences the effects of InterStim during a 1-week at-home test period. If this test is a positive test, the patient can then go on to have a permanent implant placed, which is a similar but somewhat more involved procedure. This is a step where a permanent pacemaker-like device is placed entirely under the skin to stimulate the sacral nerve near the tailbone. It works much like a pacemaker, and by stimulating the sacral nerve, this can help control the symptoms of overactive bladder and help to restore the patient to proper bladder function.
Issue applied in Ecuador. A trial about induced inflammation by intraperitoneal injection of cyclophosphamide to test the hypothesis that the activation of arch would reduce neural activity and by delivering a corrective signal restore bladder storage function. The results support the hypothesis activation of arch did indeed reduce neural activity and restore normal bladder storage function.
This is Juan from KenHub, and today we're going to be talking about the urinary system. The organs of the urinary system are located in the abdominal cavity, which we see here. Now, looking deeper, we see that this system includes the kidneys, like we see here highlighted on this image of the abdomen, the ureters, which leave the kidneys and travel inferiorly within the abdomen, the urinary bladder, which we see in the lower pelvic region, and the urethra, which is located inferior to the bladder, and we can see if we change views to this cross-section of the pelvis, this image right here. These organs work together as a group to filter out excess fluid, the byproducts of metabolism, and other waste materials from your bloodstream, not to mention that they also help store, transport, and excrete urine. Now let's take a closer look at the organs of the urinary system, starting with the kidneys. Before we do that, I'm just going to move here to this image again, where we're going to highlight the kidneys. The kidneys are two bean-shaped organs located in the abdominal cavity. They are located in the retroperitoneum underneath the intraperitoneal organs, which have been removed in this illustration right here. Each kidney is invested in a thin connective tissue capsule known as you would expect, the renal fibrous capsule, which we see here. This protects the kidneys from damage or injury. Also seen from this view, at the superior pole of each kidney is an endocrine gland enclosed in a fibrous capsule and a cushion of perirenal fat called the suprarenal or adrenal gland, which we highlighted here. Now, these glands are not part of the urinary system and function instead as part of the endocrine system. Don't forget that. At the medial border of each kidney is the renal hilum, where the renal arteries, renal veins, and the renal pelvis enter and leave the kidneys. Note that the right kidney sits slightly lower than the left kidney, since it sits posterior inferior to the liver. And by posterior inferior, I mean basically underneath. Now that we looked at the anatomy of the kidneys, let's explore the function. The main function of the kidney is to eliminate excess bodily fluid, salts, and the byproducts of protein metabolism. This results in the production of urine that is transported out of the kidneys through the ureters, which happen to be the next structures that we're going to be talking about, the ureters. The ureters emerge from the kidneys posterior to the renal vessels. They are actually a continuation of the renal pelvis of the kidneys, which we just looked at in the renal hilum image. This video is
Conclusion. The result of the closed-loop system, neuromodulation is only provided when the device detects a problem, and in contrast to current functional electrical stimulation of the tibial, pudendal, and sacral nerves, optogenetic innervation can target specific neurons in the lower urinary tract and thus can avoid interfering with bowel or sexual function.
Our kidneys are vital organs with important jobs. They clean our blood, separate waste, and remove extra fluid, but problems can arise.
When the kidneys are not functioning appropriately, you get a buildup of those waste products and extra fluid, and there are other changes that can happen, like high blood pressure.
Dr. Latanya Hickson, a nephrologist at Mayo Clinic, says high blood pressure, diabetes, and family history are risk factors for chronic kidney disease.
Chronic kidney disease is defined by a reduction in the kidney function numbers and or an increase in the amount of protein that's lost as waste into the urine.
Kidney disease can come on slowly, often showing no symptoms early on, but it can lead to kidney failure and other health problems.
Heart disease is the most common cause of death in individuals with kidney disease.
Dr. Hickson says lifestyle changes can help manage kidney disease, so start walking, eat a healthy diet with less salt, and don't smoke.